A very beautiful morning, beautiful afternoon, and beautiful evening to every one of you, my professional colleagues, my fellow nurses. How we are doing? How is preparation for our Osce exam? If you were scared, guys, I'd like you to know you have to calm your nerves. You have to be relaxed. Osce is a very simple exam, so don't experience any anxiety. Don't experience any tension. Don't be scared. All I will advise you from experience is keep practicing. Keep practicing with your pillows. Practice. Osce exam is frequent practice. Don't get tired of practicing, because as soon as you write your Osce exam and as soon as you get your pin, that ends it. So don't get tired of practicing. All right, I wish you a success. I wish you a massive success. Lest I forget, big congratulations. I've not read messages, but I'm just saying, as it comes, a lot, like, you know what I mean, as it comes. I'm just saying thanks, I passed my Osce, thanks, I passed my... I've not been able to read all the messages. So guys, I celebrate with you all who have passed your Osce exam. I share in your success story. I'm super proud of you. I keep saying nurses are very intelligent. I'm not saying it because I want to encourage you. That's just the facts. You need to see the way people are passing their exams. I'm so excited. And doing our lecture study with me, the one, I give some assignments. A lot of people sent their care plans for me via email for me to mark, and those I was marking, I was reading it, I'm like, professors in nursing, you need to see those care plans. They are top notch. Honestly, I was like, nurses are truly brilliant. God, Indians, Ghanaians, Kenya, Nigerians, Zimbabwe, Filipinos, all the countries where there are nurses are in fact, we are the top. We are so brilliant. So I celebrate with all of you. All right, so keep practicing for your Osce exam. So today we are going to be doing lecture series day 2, because a lot of persons advise me that we should do lecture series. Since we've done lecture series day 1, we should plan for all the lecture series day 1. So I did a video about 4 days ago on care plan for most. So in continuation with that series day 2, I'll be doing a video today on care plan for all chest infections. I'll try to be slow today because a lot of people said I speak too fast. So today I'll be doing a care plan for all types of chest infection you can get in your Osce exam. What are those type of chest infection? We have asthma, right? Asthma is one of the common ones. We can have pneumonia, but for your Osce exam, asthma is one of the common ones where we talk about chest infection, and it comes regularly. So if you're getting asthma, of course, you're getting a news chart. For those who are writing the new Osce, guys, if you get asthma, of course, you're planning for patients with asthma. Now, I have 4 specific care plans that are very relevant to an asthma patient. 4. I will speak slowly now. The first care plan relevant to an asthma patient is what? Chest pain. Mrs. Ellie is having chest pain with a pain score of 7/10. Sick. Oh my God. Really simple, guys. Yes, really simple. So doing your assessments, when you've read your scenario and you've interacted with your patient and she speaks to you like, I'm having pain, and you said, do you mind scoring your pain, with 0 being the least and 10 being the highest? So what would you score? And the patient is telling you, I'm having a pain score of 6, I'm having a pain score of 5. So if you have that in your Osce exam, you can plan for pain. Mrs. Ailey is having chest pain with a pain score of 5/10 or 7/10. I'm keeping this simple. However, a lot of people who sent me their care plans for me to mark, they use Mrs. Aileen is experiencing chest pain due to breathlessness with a pain score of 7/10. That's fine. But I just like keeping it simple. Like, you don't have to crack your brain, especially for those of us who are not professors yet. You just find it easy. You know what I mean? So if you use Mrs. Aileen is having or experiencing chest pain with a pain score of 7/10, or with the pain score you get, it is a tick. Oh my word. Now that's one care plan you would find in asthma patients. Another care plan you'll find in asthma patients is Mrs. Ailey is experiencing shortness of breath with respiratory rate of 22 or with respiratory rate of 24. So guys, we all know when a patient is experiencing shortness of breath, their respiration is usually high. So if you get asthma as your assessment in your Osce exam and the respiratory rate is 22, the respiratory rate is high. We all know when it is high and we all know the normal ones. Maybe you get a respiratory rate of 24, so you can use Mrs. Ailey is experiencing shortness of breath with a respiratory rate of 22 beats per minute. Or you can use Mrs. Ailey is experiencing what? Breathlessness with respiratory rate of what? Of 24. Some who sent me their care plan said Mrs. Ailey is experiencing breathlessness due to asthma with respiratory rate of what? Of 24. It is a tick. So I've given 2 care plans. Don't forget, Mrs. Ailey is experiencing shortness of breath with respiratory rate of 22 or with respiratory rate of 24, depending on your score on your Osce exam. Or Mrs. Ailey is experiencing breathlessness. So shortness of breath and breathlessness, they are brothers and sisters. They are the same thing, okay? So either you use one, both of them are the same one care plan, please. Shortness of breath and breathlessness, they are one care plan for me, okay? I just use different English. So number 3 care plan you want to use is Ailey is experiencing, or Mrs. Ailey is having reduced mobility due to breathlessness. It is a tick. Ailey is having reduced mobility due to what? Breathlessness. It is a tick. Or Ailey is experiencing reduced mobility due to what? Breathlessness. It is a tick. You see, so I've given 3 care plans now for an asthma patient, and I'll give the last one. What do you think should be the last one? Ailey is experiencing anxiety due to what? Asthma, or due to what? Unstable asthma. Or Ailey is experiencing anxiety due to a disease condition. Now, what is the disease condition? The disease condition is asthma or unstable asthma, or the condition they give you. So Mrs. Ailey is experiencing anxiety due to what? Unstable asthma. Guys, these are the 4 care plans I have for you today. They are for all asthma cases. If you get any assessments, if you get news, or if you get asthma as your assessment, any of this 4 care plan go. Either you use a chest pain, patient is experiencing chest pain with a pain score of, or patient is experiencing shortness of breath with respiratory rate of, or patient is experiencing breathlessness with respiratory rate of, or patient is having reduced mobility due to what? Due to unstable asthma. Or you use patient is what? Patient is having what? Anxiety due to what? Unstable asthma. Or patient is experiencing reduced mobility due to breathlessness. Or patient is experiencing what? Anxiety due to what? Breathlessness, or due to what? Unstable asthma. So these are the 4 care plans I have for you. Somebody may be saying, how can you give us care plans without aim of care? So for all asthma, the aim of care is what? If you're planning chest pain, patient Mrs. Ailey is having chest pain, the aim of care is what? Mrs. Ailey is going to verbalize relief of pain with a pain score of less than 2 out of 10, right? Mrs. Ailey will verbalize relief of pain with a pain score of less than 2 out of 10 for pain. Then if you're using shortness of breath or breathlessness, I told you both of them are 1. You can use what? Mrs. Ailey will verbalize relief of shortness of breath with respiratory rate of what? Of 12 to 20 breaths per minute. Or Mrs. Ailey will have normal breathing pattern. Without of them is okay, but I rather prefer you use for shortness of breath or breathlessness. I rather use Mrs. Ailey will verbalize relief of breathlessness or relief of shortness of breath with respiratory rate of what? Of between 12 to 20 beats per minute. All right, or within with respiratory rate of between 20. Oh my word, what is wrong with me? So Mrs. Ailey will verbalize relief of shortness of breath with respiratory rate of what? Of 20 breaths per minute. All right, I hope it's clear. Respiratory rate of 20 breaths per minute. All right, so what about for mobility? If you have the opportunity to plan for Mrs. Ailey is having reduced mobility due to what? Unstable asthma. So if you happen to plan Mrs. Ailey is having reduced mobility due to breathlessness or due to unstable asthma, the aim of care will be what? Ailey will mobilize with assistance and independently within the limit of our what? Disease condition. Ailey will mobilize with assistance as the aim of care and independently within the limit of our what? Of our disease condition. Now, for all asthma cases to be reevaluated today, you write today's date, hourly, and or as the clinical condition changes. So for all asthma reevaluation date to be reevaluated today, put today's date. I like being very specific. hourly, and or as the clinical condition does what changes. Now, so let's quickly plan for chest pain. No, I wouldn't plan for chest pain. Chest pain is the what is the easiest. Explain all aspects of aim of care for chest pain. Early visualized release or relief of pain of less than 2/10, right? Reevaluation date to be reevaluated today, and I said right to this date, hourly, and also as the clinical condition changes. Now, Immatarid makes your care plan simple. If you've not seen my video on Immatarid, go watch it. Explain and discuss all aspects of care to the patient. Monitor and record ALIS observation. Now, you're not doing your assessment. If you're having asthma, it is news you are doing. Now, if you have a news of what? Of 4. So, and you are doing a care plan for chest pain for an asthma patient, how will you write this? Monitor and record Mrs. ALIS observation 4 to 6 hourly and escalate as per news 2 policy. Tick. So you can use your news score, because the news score tells you how often you should escalate. Now, what if the patient is having 3 in a single parameter? Maybe in respiration, the patient is having 3 in a single parameter. The patient is having 3. You can write monitor and record Mrs. ALIS observation hourly and escalate as per news 2 policy. Tick. So your monitoring frequency for news has to be based on the news score the patient has. We all know that news of 1 to 4 is what is 4 to 6 hourly, and news of 3 in a single parameter is what is hourly. Guys, you don't have to cram anything. Remember doing your planning. Planning is 15 minutes, and they'll be giving you your assessments, everything you need to know. So it's not like you're cramming it. Everything is there for you, okay? So don't cram anything. If it's news of 4, when you check the back of your news score, you know, you will see there 4 to 6 hourly. So then you write monitor and record Mrs. ALIS observation 4 to 6 hourly and escalate as per news 2 policy. Because we are planning with chest pain, assess Mrs. ALI for any word. Assess Mrs. ALI for pain using the pain assessment tool. Immatarid, administer or prescribe medication and oxygen therapy and monitor its effectiveness after 30 minutes. Teach Mrs. ALI deep breathing exercise and adequate positioning for what? For optimum lungs expansion. We've said administer or prescribe medication. Refer Mrs. ALI to pain management team or pain assessment team. Inform Mrs. ALI to use the call bell. Document all care as planned. I will give all the self-care activities together. All right. Now, if we say Mrs. ALI is experiencing shortness of breath, let's plan. Mrs. ALI is experiencing shortness of breath, or Mrs. ALI is experiencing breathlessness with respiratory rate of what? Of 24. What is our aim of care? Mrs. ALI will verbalize relief from shortness of breath with respiratory rate of 12 to 20 breaths per word per minute. Reevaluation date to be reevaluated today, every hourly, and or as the clinical condition changes. Explain and discuss all aspects of care to Mrs. ALI and gain consent. Monitor and record. Let's assume the patient has a new score of 4. Monitor and record Mrs. ALI's observation 4 to 6 hourly and escalate as per news 2 word policy. Assess ALI's breathing pattern. Assess the rhyme. Assess the depth. Chickena. Or you can say assess Mrs. ALI for any sign of respiratory distress. What are the signs of respiratory distress? Such as what? Stridor, cyanosis, labored breathing, unequal entering of air. So you can say assess Mrs. ALI for any sign of respiratory distress, such as what? Use of accessory muscles while breathing, stridor, coughing, or unequal entering of air. Immatarid. The next one is T. Teach Mrs. ALI deep breathing exercise and adequate positioning for what? For lungs expansion. Administer or prescribe medication and oxygen therapy and what? And monitor its effectiveness after 30 minutes. Refer Mrs. ALI to respiratory team, because it's asthma now. So refer Mrs. ALI to respiratory team or the medical team. Inform Mrs. ALI to use the call bell. D, document all care as what? As planned. Then what about Mrs. ALI is having reduced mobility due to breathlessness? The aim of care is what? Mrs. ALI will mobilize with assistance and independently within the limits of our disease condition. So when you're planning, Mrs. ALI is experiencing or Mrs. ALI is having reduced mobility due to breathlessness, the aim of care is what? Mrs. Ellie will mobilize with assistance and independently within the limits of her disease condition. Reevaluation date to be evaluated today, write today's date, hourly, and or as the clinical condition changes. E, explain and discuss all aspects of care. We know that one. Monitor and record Mrs. Ellie's observation depending on the news score. 4 to 6 hours if it's a news of 4, and escalate as per news 2 policy. Assist Mrs. Ellie with activities of what? Of daily living while avoiding patient dependency. So assist Mrs. Ellie with activities of daily living. Why what? Why you're trying to avoid patient dependency. Or if you will write assist Mrs. Ellie with activities of daily living and try to assist Mrs. Ellie with activities of daily living while avoiding patient dependency. Because while you're trying to assist her with activities of daily living, you don't want her to totally depend on you. But if you write assist Mrs. Ellie with activities of daily living, that's fine. So teach Mrs. Ellie deep breathing exercise and adequate positioning for what? For lungs expansion. The next thing you want to do, what else do you want to do? You want to do what? You want to administer all prescribed medication and oxygen therapy and escalate as per news 2. The next thing you want to do, you want to refer Mrs. Ellie. Who are you referring Mrs. Ellie to? To the occupational therapy and what? And medical team. The next thing you want to do, you want to inform her to use the callback, and the next thing you want to do, you want to document all care as what? As planned. And finally, if you want to plan for the 4th one, which is Ellie is experiencing what? Anxiety due to what? Unstable asthma. Ellie is experiencing what? Anxiety due to what? Unstable asthma. What is the aim of care? Ellie will appear what? Very relaxed, or Mrs. Ellie will appear what? Relaxed. Reevaluation date to be reevaluated today, hourly, and or as the clinical condition changes. E, explain and discuss all aspects of care, and and gain consent. Monitor and record Mrs. Ellie's observation depending on your news score. If it's news of 4 to 6 hourly, and escalate as per news 2. A, assess. What are you assessing? Assess for any signs of anxiety. Yes, assess for what? For any signs of what? Anxiety. And guys, what are the signs of anxiety? When a patient is anxious, you see them what? You see them with fast breathing. So assess for any signs of what? For any signs of what? Anxiety. To be honest, one of my students did a care plan on this, and she did it so well. She did it so well that I was so impressed. I'm trying to read for you. Okay, I think I'm finding it. She did it so well. She planned for what? Anxiety. She said, look at her plan for anxiety. Ellie is experiencing anxiety as evidenced by what? Patient verbalization. How beautiful. This is our own care plan. The aim of care, she wrote what? Mrs. Ellie will appear what? Relaxed. Exactly what I said. Perfect. And the reevaluation date she wrote to be reevaluated today, hourly, hand or as the clinical condition changes. So we said E, explain and discuss all aspects of care. We said monitor and record Mrs. Ellie's observation. We said what? Assess for any sign of what? Anxiety. What are the signs of anxiety? Irritability, restlessness, and irregular heartbeat. So assess for any sign of what? Anxiety, restlessness, irritability, and what? And irregular heartbeat, and escalate as what? As needed. You see now, very, very well, simple. I'm sure we can do the rest. What are you teaching a patient that is anxious? You teach patients what? Relaxation techniques such as deep breathing exercise, diversional therapy, watching TV, listening to music. You administer or prescribe medication and monitor its effectiveness after 30 minutes. Arrow is refer. Where are you referring this patient to? You are referring patient to what? To what? To psychotherapy or the mental health thing. So I would prefer you refer patient to what? Psychotherapy or the mental health team. Then what the else do you have to do? You have to inform patient to use the callback. You have to document all care as what? All care as planned. So guys, those are the 4 care plans I have for you. Now, what about the self-care activity? Self-care activity, I can give you 5. If you're writing the old Osce, you need a self-care activity. But if you're writing the new Osce, you don't need a self-care activity. So for the self-care activity, number 1, when you say explain and discuss all aspects of care to patients and gain consent, number 1, Mrs. Ellie understand all aspects of care explained. 1, Mrs. Ellie consents to what? To treatment. If it's pain, Mrs. Ellie understand the pain assessment to use. If it's 4, Mrs. Ellie understand the 4 weeks assessment to use. Mrs. Ellie participates. In fact, let me give you 7. Mrs. Ellie verbalized understanding of a plan of care. Mrs. Ellie consents to treatment. Mrs. Ellie participates in a plan of care. Mrs. Ellie is able to use the callback. Mrs. Ellie understands reason for referral. Mrs. Ellie tolerates all medication administered. Mrs. Ellie understands health education given. That's all. Ellie verbalized understanding of a plan of care. Ellie consents to treatment. Ellie is able to use the callback. Ellie tolerates all medication administered. Ellie understands health education given. Ellie understands reason for referral. You know, so simple. So what? Simple. So guys, that's all I have for you today. Care plan for what? For all chest infections. So if you have a care plan on asthma, oh my god, it is a goal, because definitely you're going to do well. So thank you so much guys for staying in touch. Don't forget to like this video, don't forget to subscribe, and don't forget to share my videos with your friend preparing for Osce exam. So I will see you in my next video, and until then, keep passing your Osce exam. I love you all guys. Have a beautiful day, and bye. And until I see you again, keep passing your Osce exam. Bye guys.